We're live on YouTube, Chair. You can start the meeting.
Oh, thank you, Naz. Apologies.
One apologies from Sajmir.
Okay, thank you. Declarations of interest in the normal manner. Okay. Minutes of the last meeting. Can somebody tell me they were okay?
They're all fine.
Thank you. And welcome and introduction. So, well, I don't think everybody needs to do, but Snow Bear, you could better introduce yourself because I don't think many people have met you. Well, I haven't, so go on.
Hi, I'm Snow Bear. I'm the new trainee solicitor at Rochdale Borough Council, and I'll be observing today.
Oh, trainee solicitor. Well, you'll get lots of work working for Rochdale. Dear me. Okay, welcome. Who else? Kate Jones, has she been here before?
Morning, Chair. I'm the Chief Exec of Health Watch Rochdale.
Right, you have. And who's this guy here? Ashley Durnley. Would you like to introduce yourself and say who you are?
Yes, I'm Ashley Durnley, councillor and leader of the Conservative group in Rochdale.
All right. Is that the loyal opposition?
The loyal opposition to the Conservatives.
Well, dear me, you never oppose the Tories. Okay. Okay, we've done the welcome introductions. So I'll move on to intelligence update, please. I hope it'll be briefer than yesterday's meeting with Mr. Burnham. Is it you, Anthony?
Yeah, I think so. I sent some slides through. Are they available?
Yes, it won't be a second.
Right. Yep, okay. Can we get full screen at all, or is that the way it's going to be? Okay, great. Yeah, just going to do the usual update on the changing picture. Next slide, please. Do I change the slides or?
Just a bit slow.
Oh, okay. Well, in this next slide, when it arrives, we're comparing our December position with where we are in January. I'll just recap the December position. In December, we had the cases were slowly going up, and we had around about 400 cases per 100. Our maximum got to, we had about 400 cases per week, and it was stabilizing around that amount. Oh, good, we're getting there now. So we had 400 to 500 cases per week, and it was stabilizing around that amount. But we were desperately concerned that if we didn't have a Christmas lockdown, cases would rise. Obviously, we did have the Christmas lockdown, and that helped enormously. But we were still concerned at that point in time as to what would happen post the holiday period. With a lot of other areas seeing a huge spike in cases associated with the Christmas shopping period and obviously the celebratory period around about that period. So what did we see locally? Well, locally, we hit our peak just after the lockdown on the 4th to the 10th of January with 843 cases, around 380 per 100,000. Now this is high, but it's not as high as we had in our October and November peak. So what we can deduce from that was that this third wave, which I'm calling it a third wave because I think that we've been through a second wave, which started much earlier in Rochdale. So I would say this is actually a third wave, which is to do with the December period, is not going to be as bad as our second wave. And this is what's happening now. And we can be very, very confident now that moving forward, we will not see a terrible increase in cases in the hospitals or deaths, because we've gone past our peak and cases are now beginning to fall. And we're seeing the weekly cases begin to come down. They've come down this week from around about the 840 to the 700s, and they're now at 577. So they're coming down, but not as rapidly as we'd have hoped for. Now, there are two possible reasons why they might not be falling as well. There are three possible reasons. Two of them are to do with the fact that we're doing more testing. So as you test more, you might get more cases. We're not actually comparing like with like. And this has been a bugbear throughout the whole of the pandemic, that we've tested at different rates throughout. So it's not very, very consistent. The second reason for cases remaining and plateauing a little bit appears to be cases in the workplace. And the third reason is this all-important new variant, which has increased rapidly. And that new variant, if it's slightly more transmissible, maybe making it harder to drive the cases down. The rest of the story is pretty much good news here, because the positivity rate's falling, our cases in the over 60s are falling, and of course we've got the vaccinations coming. Next slide, please. Shame about the pace. Right, so deaths peaked in November. We're past that. Cases were falling. We were worried about that. We've had the early rise in January cases. New hospitalisation should now have peaked. Sadly, we're probably going to see a rise in deaths over the next couple of weeks, which are associated with the past rise around late December, early January. The new variant has took off very, very rapidly locally and has become the dominant strain. A few weeks ago, only 14% of the cases that we saw were this new variant, and now it's around about 75%. Now, to some extent, I feel that it's quite good news that the cases that this new variant hasn't caused a massive spike in Rochdale. In other words, we're pretty confident that our current measures are working to keep things under control. But as I said before, we'd like to now see the cases going down. But of course, they should start to go down with vaccinations. Next slide, please. So what next? Well, we seem to have avoided a very bad third wave, but the new variant still remains as a worry. We really do have to drive our cases lower before lifting any lockdown. Now, the vaccination programme has started and it's working apace, and we're up to 37,000 people have now had their first dose of the vaccine, which is absolutely fantastic. So that's moving forward apace. I had a look at this, and when you think about the people who are getting the vaccine and the fact that that should help transmission, and also all the people in the population who've previously had the illness, we should, in my opinion, and I'm hoping this is the case, start to see the benefits towards the end of February, that we'll start to see in our figures that the figures are improving, and they're improving almost certainly because of the vaccination programme. The early signs of this improvement will be a fall in hospitalisations in people over 60. And obviously that should then tally with a fall in deaths in a longer period. We need to keep a very, very close eye on hospitalisations. As I said before, we have to be quite careful about not getting too excited if the case numbers change, because we're changing the pattern of our testing. So some of it might be because we've got some lateral flow testing going on and we get some more cases, but it might just be an artifact that we're actually finding more of the cases in the population. So it's not the same. In conclusion, the current case rate's still too high and restrictions are needed. We should have sufficient hospital capacity, but obviously bear in mind that there are winter pressures on the hospitals. So it's, you know, that the hospital system has struggled, but it's coping, and everyone's been pretty much a hero in the hospital system. I believe the worst's over, and I expect to see an improving picture week by week. The only possible problem really are these new variants. And it's absolutely crucial that vaccination uptake remains high. And it's crucial that we promote this in all population groups. Thank you very much.
Okay, thank you, Anthony. You're always optimistic. Can I just ask two quick questions from the chair? Are we keeping any statistics on people not turning up at our 4 sites? And is there any evidence that the BAME community are not taking up the vaccine at the same rate as the rest of the population? I understand from the chief exec and from my Burnham meeting yesterday that nobody's really kept any statistics, but I think we really do need to know.
Yeah, it's an extremely good question, and we're being tasked to look into this as we speak. You're correct. Ideally, we'd have uptake and coverage statistics, where uptake would be who was offered it and who turned up, and coverage would be where we'd be looking at individual populations and making sure that everyone in those populations got invited at the right time and came forward. At the moment, Andrea may be able to correct me on this, but we don't have that data at this point in time, and we're trying to build a picture from other data. Andrea.
Yeah, this is not just an issue for us, this is a national issue, and it's compounded by the complexities of how we're delivering the vaccinations programme across through multiple avenues. So we've got primary care delivering, we've got the hospital site delivering to health and social care staff, and we've got the Etihad, which is the mass vaccination. So trying to get those three routes to speak to each other in terms of the data that we're getting through is only really just starting to happen, I'd say, and we're still a way off getting a robust picture. But what we've identified is that data is absolutely critical. We've escalated that as far as we can, and the national systems are very aware of it. So the central system for data that we're getting is improving all the time, and we are now starting to see ethnicity actually coming through, which is really helpful. And we had, in one of our meetings this week, we had the first time I'd seen actually a bit of a kind of a heat map of sorts of the wards, and very definitely starting to see a picture of less people in some of our, the wards where we're having higher prevalence of coronavirus in the early days. We're definitely seeing a lower uptake of that vaccine just at the moment. So the plan is to really promote that and really get into that communities and see how we can actually promote uptake of the vaccine as strong as possible. Can't hear you.
Yeah, or maybe Chris. When people don't turn up for the appointments, do we log that?
Yeah, we have a record of that, but the systems for how we log that would be different for each site. So trying to collate all that information at the moment has been a challenge for us, but we do have numbers.
Okay, Dalit wants to ask a question.
Righty.
And then Ashley, and then Kieran.
Yeah, I've already emailed as well, but I'm just, this is from Tom Westford really. He's been asked that some vaccination centres are not operating at the moment. Is that the case?
Well, all the vaccination centres are still operating, but it's dependent on supply. So we have supply schedule for the vaccination centres, and those vaccination centres run depending on the supply, if that helps.
Yeah. And the second follow on is all vaccination centres across the borough all the vaccination centres across the borough operating at full capacity, and if not, what is the reason?
So we've got a number of slots across the borough, and we've been talking about that this morning. In fact, we talk about it daily, because now what we've got is good supply, relatively good supply of vaccines. So part of the challenge for us is responding to that relatively quick increase, if you like, in supply. So we're focusing very much on that cohorts 1 to 4, which is in the Joint Committee for Vaccinations and Immunisations priority list. You know, we've got this priority list of 9, and the top 4 of that are our care home residents, our older adults and their carers. The second one is people aged 80 and over, and frontline health and social care workers. So that's a really important group. Those people over 75 and those people over 70. And the clinically extremely vulnerable. So those are our 4 cohorts. We've got some challenges to get everybody in those 4 cohorts to come forward for their vaccines. We really have to kind of have a real push on making sure that we're as many people as in our borough come forward for their vaccination as possible. So we know we've got some gaps, and we've got a plan about how we can increase uptake across the board of all those 4. We've done very well, but actually, you know, we've still got major gaps.
Yep. Thank you.
Can I move on? Oh,
found
go on,
the email. Can you reply to Tom, please, Andrea?
Yep. I've got that in line. Yeah.
Yeah. Thank
Okay.
you.
Next, Ashley.
Yeah, well, first of all, how impressed I am with the vaccination centres and the way they've been working and the number of people going through. I was helping in the Littleborough one day, and it was coming towards the end of the day, and they'd obviously got some spare, and one of the surgeries were ringing the patients up, and people were coming out, and we stayed almost an hour later that night in dealing with people. So that's really positive. I think it'd be good to know how we're doing compared to other authorities, because my view is we're probably doing really well in getting people vaccinated. But two things. One is on Monday I was due to work there again, and it was cancelled. It's okay for me, but for volunteers, not to kind of know in advance, it's not very good to find that they're either getting there and then being told, oh, you're not needed today. We need to make sure that really doesn't happen, especially for volunteers. And another constituent contacted me. He'd been in touch with Rochdale, which certainly, well, when the Littleborough one wasn't opened, you could use the Rochdale one. We were using the Rochdale one for patients from the Pennines area. He'd contacted Rochdale because he couldn't get it done in Littleborough or something, and Rochdale said, we don't do people from Pennines anymore. Is that the case now? Is it just that the people in Pennines surgeries have got to use Littleborough?
I wasn't aware of that, so I'll pick that up, Ashley, and I'll take that back, because we should be able to be flexible, I would imagine. So yeah, I'll take that back.
But certainly originally Rochdale were taking people from throughout the borough, really, and I thought that would probably still continue.
Yeah, I'll check that out.
Can I just echo actually on the volunteers? As you know, my wife's volunteered quite a bit, but turned up the other day just to find there were so many volunteers. She wasn't needed. And now she wasn't that bothered, just that she'd got up early. Okay, we'll move on. Kieran, next.
Thank you for your report, Anthony. That was very good. It does look like there might well be a bit of light at the end of the tunnel. Well, I'd like to think that anyway. I have 2 residents who are both on the AstraZeneca vaccination programme. They've both had both doses, so they're all fine. But this week they were contacted by Healy Surgery asking them about their vaccination. Who is responsible for recording individual vaccinations? Is it NHS? Is it Healy Surgery? Is it AstraZeneca? Is it Oxford University? You know, is there a joined up system? Is it coordinated?
Yeah, I think just kind of what we were talking about earlier around the different systems that we've got for sending out appointments, if you like. So the different providers of vaccinations. The ultimate record will remain with the GP. You know, so the GP will and should always have a record of what vaccinations all of us have had. So ultimately, that's where the record would sit. However, getting a collective picture of that from across the whole of our vaccinations program is challenging because of the feed-in from the different sources. So our collective picture comes from something I think called Power BI, which is what we use to kind of get an overall picture. Chris, I think you've put your hand up.
I've got a list down here of people.
Sorry.
Have said, I'm using
Chair, I was just coming in on this particular point, though. There is also a delay in the information getting back to the surgeries, so they often don't know.
All right. Well, I hope my surgery knows. I hope my surgery knows I've had both vaccinations. Okay. Not that I had any reaction to either of them. Next, Kate Jones.
It was just really to give some feedback. Healthwatch Rochdale, excuse me, have gone out to gather some feedback on the vaccination sites, and we've had really positive feedback received, saying that it's been a brilliant experience, clean premises, and the fact that there's clinical staff present has been really well received. Also, just touching on the point against GM and how they're getting on. So we had our Greater Manchester Health Watch meeting last week, and I must say it's not the same position for a lot of the other local areas. There's been a lot of complaints coming in through the local health watch. So really happy to report that us as an organisation have received really positive feedback.
Okay, can I ask you, because I'm getting loads of positive feedback. I'm not used to getting nice emails, but we are. And everybody you meet, and of course, my wife, being down there 2 or 3 days, came back and said everybody was chuffed, which is a good old-fashioned Lancashire word. But could you just issue that out to the press, etc.? Because
yeah, we will
I
be
really
doing.
do want. I'm wanting, and Ashley, you could say something as well.
Yeah, I think we should. It's something we should be really positive about. It's super we've done. And everybody leaving thanks you for it and says how wonderful it's been. It's really good.
And
Yeah,
the only
I'm
negative feedback
I'm
I've
quite
had,
happy. I'm happy.
from, but it's one of the backbenchers, and I think it was their aged relative didn't get quite as, didn't get bowing to. All right, Janet, next.
Yes, Chair. Connected to that, I've had lots of positives which I have passed on to Andrea and Kiama at times, with quotes from people that are sending me thank yous. Today's is, please pass on my sincere thank you to all involved with such a well-run operation. It's really appreciated, from a guy that attended at Littleborough. Just on the back of that, though, the misinformation that's out there is horrific, as we know. And Chris, you're saying that the practices don't get information, but it doesn't help when a practice actually says to somebody there is no vaccination, there are no vaccinations in Littleborough because we've run out of vaccine.
Absolutely accept it's a mixed message going forward.
It doesn't help. So the misinformation from Sharon on Facebook, sorry if you're called Sharon, but you know what I'm saying, that misinformation is really hard to do. Can I just ask a question about if you don't pick up the phone when the practice rings? Because I had a call from my practice the other day, rang back, got through, and it was about my prescription, no problem. A few days later, another call, hello, can you come and do your vaccine? But I've had people who think that they've been called for the vaccine, haven't managed to get the phone call, there's no message left. And then when they ring back, they're getting either into the, I'm sorry, we're not taking phone calls at the moment, depending on which practice it is, or they're in a big queue. I love the queues because at least you know you're making progress when the number goes down, which is what happens at Littleborough practice. But what do we do if somebody's not got through on their initial phone call? Are we picking those up, either Anthony or Andrea? Can you pick up on that one? Thanks. Yeah, I'll take that back as well.
Okay, if you
Thanks,
will get all this back. Next one, Chris, did you want to come in? Chris, do you want to come in or not? No, thank you. Right, can I raise one final thing with you all? I think it is wonderful, and I think everything else, and we are helping the GPs, etc. But can I make a plea to the NHS that will they share some of the costs with us, because my budget's very tight. And as far as I'm aware, nobody's making any money and nobody wants to make any money, but we're not getting any money for all the backups we're putting in using our call centres, etc. I think it is on somebody's radar, but I just want to add my bit to that. These are issues that were raised at GMCA on Tuesday, and the other issue was raised, the one Janet's raised, is have all GP people at their surgeries, or have all their people who take the calls received training? And all I can say is I phoned my GP for another issue, and I was most impressed by this new system. You're number 4, 3, 2, 1, hello. And I thought, why can't some of the private sector do that and have that system? Great. So on the costs, can we raise that behind the scenes?
Could I come in? Just to flag up that they are aware of that nationally. I think what was not recognised initially was the amount of support that our primary care networks might well need in terms of logistics. So primary care is doing a fantastic job of delivering this and leading the community delivery in particular. but I don't think there was an awareness of the logistical challenges. So I know that on the CMO call that did come up. Whether or not we see any money soon is another thing, but that is recognised.
Okay. Any other questions or comments before we move on? Just a minute, let me check in the chat again. Okay, I'm getting somebody saying it's a pleasure to volunteer. That must be Gail Hopper, etc. All right. I think it's a pleasure when Mrs. Brett goes out of the house, yes. But no, that's me being my normal facetious self. Can I move on? The next one I've got is Health Protection Board and Outbreak Plan. Who's leading on this?
Me. I think we've got a set of slides for that as well.
Won't be a second.
It's brilliant, thanks. So I'm not gonna go through this. There's a detailed set of slides which also acts as a bit of an update report. So I won't go through all the text on this, but it is available for people to have a look at, and we're happy to take questions on any of the details that are in these slides. So this is just going to whistle-stop tour through the key components of our outbreak management plan, and our this board, the engagement board, is the key board that oversees this plan. So this is the kind of almost like a key report that will come in this format every time. So could I go on to the next slide? Just on testing.
Sorry, just a bit slow.
Yeah, it's all right. So on testing, people will know that we've got the access to the symptomatic testing, which is we call it the PCR testing, and that's for anybody that's got symptoms right from the outset. At the early part of the pandemic, anyway, we had that set up, and that still exists. And we've still got plenty of capacity around that, and we're still encouraging people to come forward for a test if they have symptoms, and that's the key route for anybody who has symptoms. We've also got our 6 weeks surge program, if you like, around rapid testing, and that's our fast testings, find and stop transmission testing. And these are the lateral flow tests which we've been using, and we've got those widely available now across the borough. We've got 4 sites for that. We've got Hayward Sports Centre, Middleton, Bowley. We've got Littleborough, which is Hare Hill Bowling Green, and in central Rochdale, that's Nye Bevan. And we've had really good support around that. We've had people coming forward to volunteer for that. And despite the weather, we still have people coming out over the last week or two, which is really encouraging. So if we want to move on. Next slide.
Very slow today.
It is slow. I'll have to give you an earlier heads up.
There we go.
It's not changed on mine. Okay. What's the header on this slide? There's big chunks missing on my slide.
Contact tracing.
All right.
Contact tracing.
So yeah, so as we've had contact tracing in from the early part of the outbreak, and contact tracing becomes much more interesting for us the smaller the number of cases that we have. You might have seen on the in the news that we've got these new variants, and when we've got a very small number of the new variants, we're seeing mass kind of targeted testing to see if we can actually clamp down on those smaller number of cases. Where we've got large numbers of cases, contact tracing becomes much more difficult, because obviously we've got an exponential growth in the number of people you've actually got to contact, and it becomes less of an effective tool, if you like, in controlling the outbreak. As the numbers come down, this contact tracing starts to come into its own again. So, you know, obviously we're still in the process of doing contact tracing, and we've still got, you know, a really strong approach to that. We're using our infection control duty desk as well. We get at least 100 emails into that duty desk each day. I know some days it's been much higher than that. We've got a very active approach to dealing with the contact tracing. Do you want to go to the next slide? We do see some outbreaks, but they are relatively limited. I know that there was some concern, particularly in the media, not necessarily for Rochdale, but in this lockdown, because it's not been a full economic lockdown, we've seen more of our workplaces, seeing more people in the office. And that's been flagged as maybe an area to look at going forward in this next few weeks. We've had a really strong support programme here for our vulnerable, definitely compared to what I pick up from my colleagues nationally. We've got our grants have been implemented, our winter grant, our shielding. We've got really good support packages around, you know, our homeless, our housing, our shielders. And you know, actually we've got a really strong approach here as well. So I know that Helen's on the call, so I just wondered if Helen, you wanted to just give a little bit of an update about our recent success as well for board.
Yeah, certainly. So I'm sure most of you already know, or you might have seen the press release. It wasn't a press release actually. The Rochdale Observer had picked it up on Rochdale Online, but we've been successful in securing some funding from the Ministry of Housing, Communities and Local Government for a Community Champions programme, which kind of recognises the world outside of the kind of health system in terms of what can be done differently in communities that overcome the kind of health inequalities that are very clearly experienced in COVID, as well as many other health issues. So the programme kind of covers various different things, but sort of training and awareness raising around health inequalities and the things we can do about them across the community voluntary sector, the volunteers that are responding to COVID in lots of different ways, as well as providing support directly into the voluntary community sector organisations that can reach those communities best, either through participatory budgeting or through the provision of staffing resource so that they can expand quickly without it being a huge sort of shock to the system. We've also got insight gathering that's feeding in through Diane's on the call, I think, isn't she, feeding into the kind of behaviour change world, and then the kind of coordination of the messaging that's already happening in, for example, the COVID-19 community engagement space, where members of the community and community leaders are able to kind of challenge myths that might be going around to do with COVID, and to be sort of proactive at getting factually correct messaging out to people. So it's a huge programme of work, and it's worth way more than the 500,000, because what we've been able to do is kind of bring to bear the resources that we already have in the system and add value to that through the programme. But we've been focusing our attention in the early starts of this around the kind of just not missing a single opportunity to reach people through the vaccination process. So either because they're coming in for a vaccine, and it's an opportunity to reach older people or people with particular barriers, or because they're being contacted about the vaccine and might be a bit reticent about it. And we can also provide sort of health equality support to people through that bit of the process as well. So yesterday we launched our volunteer support programme, the Community Health Champions programme, which is being supported by Living Well. And using the sort of good help methodology, looking at how we can have good quality conversations really quickly in a mask at a 2 metre distance, possibly with people who are hard of hearing, and how we can convert that into making sure people have got the support that they need, both in terms of health and other inequalities.
Thanks, Helen. Just to say, the community WhatsApp group, I don't know whether you said it was a WhatsApp group, but as a DPH, that's been an absolutely fascinating insight into some of the messages that circulate within the community and some of the myths that persist. But what I've really noticed is that, particularly this last few weeks, people are starting to support each other with correcting some of those messages, which is less coming from us, it's coming from pretty much within the community, which is quite interesting. People are getting much more kind of really knowledgeable about some of this and starting to do that themselves, if you like, which is quite good. Can you have the next slide, please, actually? Sorry, Helen, did you have something to add on that?
Just really quickly, that group is, I just think it's the most fascinating thing in the world, that group. And what I see is the changing dynamic between the relationship between the system and that impenetrable world of bureaucracy and the community. And it's kind of happening before our eyes. So we talked yesterday about using a transactional analysis sort of process to understand parent-adult-child relationships. And we're very much shifting from parent-child to adult-adult in that group. So yeah, long may that continue.
Thanks, Helen. I know that Dan's on the call, and Dan's been very much at the forefront of the behaviour change work that we've been doing for a while now. I wondered, Dan, do you want to just go through this slide, just give an insight into what the work that you're doing entails?
Yeah, absolutely, and it's absolutely integrated, isn't it, into the work that we're doing with Helen, like she's just said, and the work we're doing to protect our vulnerable. So there's sort of 4 key big sorts of pieces of work programs coming out at the moment of this. One of them is very much, as Helen's just been talking about, really maximising the vaccinations and the opportunities that the lateral flow testing bring us as touch points to influence behaviour of our most vulnerable groups, and to sort of support people to support our most vulnerable around COVID. So like Helen was just saying, around these the good health training and good health conversations for the volunteers when they meet people in the actual vaccination centres. We've been circulating the Keeping Well in winter packs as well as people come in, so that they have that information about how to keep themselves well and keep themselves safe for a longer term, ongoing. We're also looking at street engagement around the roving sites, so that we can really get messages out into the community, yes, about the lateral flow tests, but on top of that, around vaccinations and around the wider protective measures. And again, on the back of what we've just saying, we're developing a sort of myth-busting 7-minute briefing, because like you've just been saying, there's so many myths around vaccinations, and people are doing a really good job at coming back with answers and support. But we thought it would be really good to pull a sort of 7-minute briefing together so that we can bust some of those myths, and then people who are on that front line and those trusted people are more confident in having the conversations with people and supporting them around the myths. So there's the work around the vaccinations. We've also been doing a lot of work around isolating. There's still a lot of concerns around the number of people who test positive or our contacts and really don't either understand what isolation means or have a very low incentive to isolate. So it's really around trying to support people in what's available for them when they are isolating. As Andrew mentioned, we've got our DEFRA grants, we've got the household hardship grant, isolation funds, we've got the helpline. There's lots of things to support people. And again, we're looking at a 7-minute briefing for that so that we can get better messages out around what isolation means, and we're translating it, which will be great. And we are looking, I don't really want to call it a last big push, because I think listening to Andrew, especially in the last meeting in the Health Protection Board, we're not quite sure how long this is going on for, but we really want to try and reinforce those basic protective measures and remind people the importance ongoing of your hands, your face, your space, and that we're in this together. So we're doing a number of pieces of work, and we're trying to work with different groups who are quite influential for targeted groups. So we're working with the football club because of the reach of people that they have. We're working with an Asian ladies group who meet down at Touchstones, obviously not at the moment, but virtually. We're working with M6 Theatre, to produce sort of a set of short videos, really emphasising that sort of protective measures and let's do this together and let's keep, around the protective measures. And we're also looking, and you'll be hearing more about this, we're going to be producing some kindness masks. So early on in the pandemic, Action Together, working with Living Well and other voluntary sector organisations, produced some kindness cards, and it was all around kindness messages to support each other around COVID. And local schools designed some brilliant logos, if you will, for them. So we've got one from Middleton, really good. So what we're looking to do now is to use those lovely local logos that we've got, these hearts and these drawings, put them onto some reusable masks and do some sort of really good promotion, working with comms and out in our communities, to sort of use these masks to symbolise this big push, you know, we're all in this together, let's get through this, let's keep supporting, let's keeping our distance, let's keep washing our hands, etc. And so we've got on the 14th of Feb is Kindness Week. So we're hoping to sort of launch the kindness masks and these messages in a couple of weeks for that. And then I think last but not least, it's about pushing the support that's available so that we can reach out. You know, we've still got the helpline, we've still got the information on the website. There's lots of support out there. Working with the economic support group, we've just produced this financial triage tool, which I know a lot of you have available, so that hopefully a lot of our voluntary sector groups and frontline staff will be able to provide more support and point people in the right direction around financial support that's out there, because we know the impact that's coming economically. So yeah, there's lots of work going on around supporting people around behaviour change and that community engagement work.
Thanks very much, Diane. Just to kind of emphasise, from my perspective, we've got all these kind of elements of the control, you know, the controlling the virus, you know, the vaccinations, got the testing, the enforcement that we do. Actually, this component, which is, you know, we call it our non-pharmaceutical interventions element, which is changing behaviour. That partnership with our residents is the hardest, but the most effective bit. So all this work is really critical, absolutely. I'm not going to go into detail too much on the next slide. That's the workplace prevention. So if we could go to the schools slide. Gail, I wondered if you wanted to just pick up on any key issues around schools.
I will, if I can see what's on the slide. Okay. Yeah, as the highlights show, the numbers have dropped in schools quite significantly so, despite the fact that we have around 26% of all children in schools. Highest numbers obviously in the primary schools, less children in secondary. But I think last week we had, I think it was 30 cases and 18 staff. So numbers dropping. Staff are taking up the opportunities for the fast testing, the rapid testing, and they've responded really well to that. And so it's gone in the right direction. The area we worried about for the first 2 to 3 weeks of the new term was in nurseries, because our numbers really went up in the private and voluntary and independent sector nurseries, but that settled down last week. So we're keeping a really close eye on that. Obviously, contact tracing has continued. That's always been in place. And doing a lot of work with the schools around how they manage cases and implementing the preventative measures. You know, they've all got good risk management plans in place. But I would say that in the last week, because we have the COVID inbox, as we call it, that's a team in the school service that really supports schools. We've just reached a stage where we think that there is a danger of schools becoming over-dependent. And they're starting to ask us questions that they really know the answers to. And it's almost as if, well, they can think about it. You know, it's just worrying us a bit. So we're doing a little bit of gentle pushing back with them. But generally, they've responded really well. The next step is obviously going to be what the decision is about schools returning, because from a meeting I was in this morning, there's clearly no decision yet. And the government seems to be really struggling with the possibility of taking regional approaches to that. they seem to want an all or nothing approach, which isn't helpful. But we're working with public health to keep an eye on those rates of infection in schools, looking at those where we've got 4 schools this week that have worried us a bit. But then when you see that there are 4 schools in central Rochdale where we've had high levels of concern and there's low levels of testing in those areas, it really emphasises the importance of our data that we get regularly, because we can compare and contrast things very easily. But we do worry about the fact, as schools do, that families don't always follow the rules. So they may be doing their very best in schools, and people are not following them consistently out of the area. And just to add a point to that, we've had less worries this time around the older age group. The youth service have continued to work on a detached basis, and there are very few young people out and about. So they've been visiting them at home and confirming that they are at home. And, so the older age group, which was probably the area we worked with more on the streets in the first lockdown, we're just not seeing them out and about. So there's some good things to be said for bad weather. But managing the staff concerns has been harder in primary schools than anywhere else. And that's probably because a number of senior staff, head teachers in primary schools have ended up in hospital and have been quite poorly themselves. And we have a third of our schools workforce are in the age group of over 50. So it's not surprising that it does worry them, but we continue to work with it. Is that okay?
Thanks, Gail.
Can I just temporarily leave the meeting and leave Chris in charge? Chris, I don't see anything on the chat, just so that I can get these people off my doorstep.
Yeah, no problem.
Okay.
Thanks, Chad. Just
okay, carry on, Andrew.
I won't go into too much depth about enforcement. I wondered actually maybe at the next meeting we go into a bit more depth around workforce and enforcement, actually, because there's quite a lot of information that we go through at these meetings, so it might be good to take a more focused approach. I'll go on to the last slide, which is vaccination, just to kind of make sure that we've got a roundup really of the discussion around vaccination. Just to say that we are on track to have offered everybody in that priority cohorts 1 to 4 an appointment by that 14th of February date. So we're on track for that. The challenge is to make sure that we've got all those places filled, that people come forward, that they come forward when they're invited. We're also starting to plan, and we've done the modelling actually for the phase 2. So what happens when we move into that priority groups 5 and beyond? And we know that that priority 5 group is really big. So the further down that age group you go, because you can imagine, the population pyramid gets wider. The lower down the age groups you come, actually that cohort's quite big. So we've started to look at that group and actually understand some of the subgroups within it. So what proportion of that age group actually may have other conditions, if you like, or conditions that might be of interest to us? Might we want to bring those forward before, or they might be the first ones we bring forward. So we're doing some work on that. And like I said before, really just getting our staff take up as high as possible. So we're doing some targeted work, like I said, on our care homes, our dom care, and we will be putting out on social media and on our website just some additional information to try and promote that, really. So that will be coming out today or tomorrow, I know. So yeah, so that's it for me. Any questions? I'm happy
Thanks,
to
Andrew.
answer.
Janet, I think you want a question?
Just a question, Andrea, on when we get into the next age groups. One of the things that was suggested to me was that we have a hot list that we can ring at the last minute to get people in to use vaccines up and so on. This next cohort that's coming in is going to involve people with work commitments, so they're going to perhaps be harder to accommodate. Is there a possibility that we may be seeing our vaccination sites open till midnight? This is not this is not me trying to put more work on people, but I know that there are some sites that do operate right the way through, because as I said, this next cohort is harder to accommodate with. I know not everybody's in work and some people are furloughed, but they are going to be harder than the retired sector. Yeah, we've definitely got. Oh, sorry, Chris, you want to come in there?
I was going to say, I think from a GP perspective, when they signed the contract, it was a 7-day week contract, 8 till 8. So I'm not sure about midnight, but certainly there'll be 7-day working as it ramps up, my understanding. But maybe Andrew's got a bit more about working the midnight shifts.
I've not heard about the midnight shifts, but never say never.
Yeah.
But at the weekends, definitely, we've already started doing weekends. You know, we've already been doing weekends. So, and I think what I'm seeing is a real flexibility around that. So, you know, I think what we talked before about extending that at the end of the day, if we've got additional slots to fill additional vaccines, we'll be using them up if we get people in. So I'm definitely seeing that, you know, there's a real flexible approach being adopted already. But yeah, I think that's something to consider, Janet, actually. You know, we do need to think about as we get into the younger cohorts.
I think also as well, that's where the major centres like the Etihad will start coming into their own as well, that they are open longer hours. And if you're working, you're more likely to be more mobile and able to get to centres like that. And if it's through the national system, in theory, you can book anywhere. So you can book the one that's closest to work as well, for those mass vaccination sites, I would think.
Yeah, and we are going to see the pharmacies actually taking a, you know, probably a more sizable role as well. We know that we've been some pharmacy pilots, but actually we'll probably see pharmacies start to offer the vaccine as well. So yeah, so we're seeing that. Doesn't make data collection any easier for us, but you know, people will get the vaccine. Yeah.
Thank you.
Okay.
Thank you, Chair.
Thank you. Kieran, you got a question?
Thank you. Yeah, the government wants us to open schools as fully as possible, as soon as possible, as usual. However, it would be better if we open them safely, and that would help if all the teachers and teaching support staff, etc., were vaccinated. Is there any plans as yet for prioritisation for school workers in order for us to quicken the opening of the schools to the general public?
Yeah, this is a hotly debated issue, Kieran. You know, and a really good question, and it's one that we pick up on the national calls as well. The rationale for those 9 priority groups is those people who are at risk of serious health themselves, or they pose a risk to people who are at risk of getting COVID and dying, if you like. So the priorities are based on impacts on health and the NHS. They're not based on the wider system impacts, and that's where we're seeing that debate around should we be including XYZ, you know, priority occupational groups. And probably most of us would think, yeah, teachers, we would want them vaccinated, we would want schools to get back. But that's not how the prioritisation is working at the minute. What we are doing though is we are pulling in those staff that are working at that interface with the vulnerable children that we know are going to be at higher risk. So that bit we are definitely doing. I know Gail's, I think, I don't know whether you were putting your hand up then or waving, but you know, I think we are doing that actually quite well here, and we're definitely bringing those people in scope, those staff.
Also, Kieran, there is a limit. If vaccines were unlimited at the minute, then we could be creative and bend the rules even more. But at the minute, for every vaccine we give to a teacher or a police officer or another key worker, it's one we're not giving to somebody who's over 70, somebody who's clinically extremely vulnerable or such. But
and we're being monitored as well.
And we are, yeah.
Indeed, so thank you.
Okay. I can't see any more questions, and I can see Councillor Brett back in the chair. He's obviously cleared his doorstep, so I'll hand back to Alan.
Yeah, thank you about that. That was just another one of these, and because I'm not moving out, they do it on my drive. Unbelievable. I'm meeting the police in as well this afternoon now. Right, have we done item 6?
Chair, can I just make a comment about
certainly, Gail.
Thank
I
you.
saw your hand go up.
It's
And I
okay.
just,
Yeah,
right, go on.
it's all right. It wouldn't surprise me, just the meeting we were in this morning, I think we agreed right across the region, it wouldn't surprise us if one of the government's responses to the teaching unions in order to get children back to school was for them to change their position in relation to priority groups and to give us really short notice. But we've briefed all of our schools, and the evidence is quite strong as well, Kieran, as hard as it is for people to hear it, that if you look at the numbers of very serious illnesses, people who've spent time in ITU and deaths, the teaching group comes out much lower than the other groups that are a higher priority currently. But I know that's not a popular view to hold. But that's what the evidence is telling us. And as Andrea said, for those who are working with children with clinical difficulties and health needs, we have prioritised those. So the special schools have been prioritised. Is that okay?
Thanks, Gail. Thanks, Kieran. Is there anything else on that? Right. Is it community engagement update, etc.?
Yeah, I'm just wondering whether colleagues feel they might have already covered this in the discussions that we had earlier with the slides, but yeah.
I think we've covered most of that, Alan, and I can't see Mark on the
Okay,
call.
well, can I just raise another thing that I'm sorry to keep bringing all this stuff back from GMCA, but if I've got to suffer 2 and a bit hours of them down there, you can get some of the feedback. One of the things, since we're planning for the future, etc., is what happens. Can we just tell me and reassure when the second vaccine start after 12 weeks, right? So you're going to be vaccinating all of those, yes? But I presume you're going to continue to do first vaccinations.
Yes.
Am I right?
Yes.
Right,
yes.
well, then surely there's going to be some pinch points and it's going to be a logistics, not nightmare, but it's going to be a real logistics problem.
Yes.
Can we, next time we have an engagement board, can somebody talk us through that? Because I'm already being asked questions. How are you going to continue to do first vaccine while doing second vaccine?
Yeah, we will do. We're constructing as detailed a plan as we can around that, with the caveat that it is still dependent on that push model that the central team have got. So we can plan as much as we can around what's in our control, but vaccine supply will be a critical issue. But yeah.
And is there any evidence, does anybody know that the push model might change?
That's not been talked about to me yet, but they do anticipate that it will change. But okay. I can't see it changing in the next couple of weeks for sure.
All right. And then can I raise the other one? And this is especially pertinent to politicians, of course. I've been on no end of discussions this week, both party political and national, about the push for the general election, not the general election, the local elections. Now, if there's ever going to be people coming out or not, then that. But the government seems determined that we will have the elections. I'm not going to object to that. It's how we do them safely and how we don't discourage, democracy, because we can't deliver letters or knock on doors. And therefore, that to me is not a proper election. But on the actual election day, you've got a logistics nightmare, in my opinion. And as for the count, you've got another one. So can I put that on your horizon as well?
Yeah, can I have feedback on that, Alan?
Yes, please.
So we raised this with the CMO this afternoon, and he didn't have an answer to that, but he recognised that exact challenge. So they putting ballots into a box in itself isn't particularly risky. You can manage that, but our politicians and the public, the potential interaction that you've got there with the normal process of door knocking and leafleting might be a lot trickier. So yeah, that was definitely recognised. But he was saying that that is going to definitely be a political call rather than something I think that he would be involved in calling. But yeah, a real tricky one.
Well,
yeah.
The call I was on yesterday, Lancashire County Council were on it, all right, and somebody I know very well, in fact he works for us in Pendle, said, well, you think you got problems, Grey Manchester? He said, I've got Lancashire County Council elections, I've got an all-out election in Pendle, I've got the Police and Crime Commissioner, all right, he said, and then we have parish councils. He said, but apart from that, it'll be a very pleasant first Thursday in May. I just said, oh, all right. So, yeah, but it's how you do the count, I think, that's the thing. Because as you know, we all like to gather and we all like to lean over and check that every vote that we get. But, okay, it's as long as all these issues are being raised. Okay.
We could actually ask our infection control specialist nurse to actually have a think about that. That might be useful actually for us just internally to see how we might actually manage that. Some of the risks that we might have there.
I don't think we can have vote counters as a special group to get earlier vaccination.
Yeah. Well, what's ironic is most of the people that work on the polling stations, Chris, probably will have had the vaccination, because they tend to be mainly elderly people who've retired.
Mm.
Well, we don't want to take them away from the vaccination centres if they're volunteering there.
The thing about polling station duty is they get paid.
Okay. Yeah. Okay.
So there it is. And the other thing is, I think we should perhaps somebody should send a thank you to Mecca. I know it took a bit of doing, but giving us the free. I think it was pressure from me, Mark Widdup, and the number of people who were getting parking fines because the machines weren't working. But I think a thank you wouldn't go amiss, saying, and can you tell us, will you be keeping it until at least you reopen your bingo parlour? Because it really is a godsend at the moment.
Yeah, I think it was a good gesture from them.
Yeah. They were put under a lot of pressure. Okay, is there anybody anything else? Can somebody remind me when the next meeting is?
Oh, not off the top of my head.
All right.
Won't be a second. 10th of March.
Okay, so thank you everybody. Thank you all the frontline staff. Thank everybody who's working hard. Pass on our thanks to the volunteers, and we'll try our best to stop the myths. Okay, I found it safe, happy, and of course, even my GP asked me, did you have any reaction? I said no. Well, she said I did. I said, well, I didn't. I never get reaction to jabs. All right, I'm one of those lucky people.